Welcome to Focus on Scholarship. I'm Jaleh Rezaie, Associate Dean of Graduate Education and Research, and your host for today's session. Our goal at the graduate school and university libraries is to bring a focus and awareness to the exciting scholarly and creative achievements of our academic community. Our guest today is Dr. Michelyn Bhandari, an associate professor in the Department of Health Promotion and Administration at Eastern Kentucky University. Dr. Bhandari has published numerous journal articles and has conducted many presentations. Her scholarship centers around the field of public health systems and services research, which is a developing field focusing on the organization, staffing, financing, and management of public health, with an ultimate goal of helping public health to be more effective and productive in its mission to improve health status. Welcome to our program, Dr. Bhandari.
Thank you.
What is public health system and services research?
Well, public health systems and services research, as you said, it's a developing field, and it seeks to advance the evidence base regarding the leadership, organization, management, technology, and workforce with an eye for improving health status. So just as you said, it's very important in public health for us to advance this knowledge about public health infrastructure. All those things that this area of research looks at pertain to public health infrastructure. And without this basic public health infrastructure, it makes it more difficult or less efficient to operate efficient, effective public health services. So it's a field that seeks to advance that knowledge so that we can improve health status and that we can protect citizens from potential hazards, which is the goal of public health. And as you said, it's a new field, relatively in its infancy. It is growing. I've actually had the experience to see it flourish over the years, and it's based out of health services research, which primarily focuses on the delivery of medical services.
Well, could you elaborate a little bit more on personally how you got interested in the field?
Well, I became interested in the field of public health systems and services research as a graduate while I was completing my doctoral studies. While I wasn't really necessarily familiar or knew that there was a field of public health systems and services research, one of the first projects that I worked on centered around public health systems and services research. And so I quickly became adept as to what this field was investigating. One of the first projects that I looked at, that I was involved in, was looking at the National Public Health Performance Standards Program, which at that time was in its infancies, and we were actually investigating the project we were used pilot data from this national program, which attempted to measure standards of how well public health systems engaged in performing the 10 essential public health services. And so as I got involved with this, I had many opportunities to see more about the field. My mentor, who is Doug Scutchfield, who's actually an EKU alum, he's considered one of the pioneers in this field, and so I got to travel with him around the nation to, at that point there were small groups of researchers using very limited data sets, and we were actually involved in one of the some of the original studies in public health systems and services research. So it was a really exciting time to be involved in this field, and just to and then over time, I've actually seen where those groups have gotten larger and larger. And there's actually, at that time, there was really limited to no funding for the field of public health systems and services research. But since then, Robert Wood Johnson Foundation has provided a great deal of money to help build the infrastructure of this field of research. And now we've seen more researchers from a variety of disciplines become involved, and the methodology has become more diverse. So that's been an exciting thing to witness and be involved in, and to learn from people from other disciplines and learn new methodology. So I guess my original interest came when I landed on a project, but I found a field that I very much was interested in, based largely because I had had public health practice experience and knew the value of a strong public health system and being able to operate effective programs. And so I really wanted to be able to investigate those factors further.
Well, that's very interesting. Now, you do teach in the field also. How does this research inform or impact your teaching?
Well, I think the first way that it impacts my teaching is it helps me develop a more depth of understanding of the topic. So when I'm in the classroom, I have a variety of research studies or just anecdotes that I can provide from research that I can use as examples in the classroom setting. Some of the classes that I teach, or one of the classes that I teach, is planning and evaluation of community health programs, and essential to planning programs is to do a thorough assessment. And through my involvement in this research and involvement in the larger field, I've been able to increase my knowledge of a variety of different systems of measuring health status or factors that impact health status. And so understanding certain data sets that students can use for assessment purposes. And also it helps me to help students who have to do research projects and to help them become connected with measures, survey instruments or data sets that are readily available so that they can begin a similar investigation.
So you do work with the students in your research, and they collaborate with you and work?
I've actually had, in small numbers, I've had students be involved in my project. One example, I had one of our graduate assistants actually was able to get funding for my research, and I hired a graduate assistant to help me in all aspects of the program. And so I had a student actually do a large part of the data analysis and be involved in developing presentations and reports with my research. And then I've also, that was the only time I was able to really pay somebody to work, but I do involve students in the research as well. Actually, next week we have a student who used some of the data that I was working on, but kind of took it in a different direction. He's actually doing a presentation next week at the American Public Health Association's annual meeting in Denver, and so he has a poster presentation, and so he was looking at kind of a smaller scale of what I did, but looking at specific public health services and investigating kind of what are the staffing requirements or what are the financing requirements that would make it possible for public health systems to engage in community health assessment or community health improvement planning.
Well, that sounds great. And now, how does your research and scholarly activity provide other opportunities in other fields or other professional opportunities and activities?
As I alluded earlier, my involvement in this is not just that I've been a researcher and that I've made presentations, but I've met numerous contacts and publish in one journal, and then they ask you to be a reviewer for that journal. So I've actually got to look at other people's studies more in depth and kind of hone maybe some of my own skills, or just by critically reviewing others, it kind of helps me to be better at writing. And so that's one example, to be a reviewer. And then I've also had an opportunity, because I've gained experience in the field, to review grant applications for the Center for Public Health Systems and Services Research, that they fund research for junior faculty are new researchers trying to create more research in the field, and so I've gotten an opportunity to review grants as well.
Well, we're getting close to end of our conversation, but I would like to ask one more last question, which is really what I'm really interested in. How do you balance such a robust research and teaching in your family life?
Well, you know, it's really, sometimes I probably don't feel like I'm balancing that well, but in the end, it somehow works out. But I think just my general principles are to keep first things first. You know, I know my family comes first, and I enjoy my family, and so if I can disengage and spend quality time with my family, and then work when I'm working, and that may sometimes be that I'm working at different, not traditional hours, that I may work after my children go to bed or get up early in the morning to do things, and that helps me to balance. And then also just the ability to delegate, really to bring in graduate assistants to help with some of my administrative or teaching responsibilities, and that kind of helps me to, you know, if they can take on some new things, then I can be able to do some of these other
Thank
things.
you, Dr.
welcome.
Bhandari, for a wonderful session. That's it for this edition of Focus on Scholarship. Please join us next time as we continue our series of webcasts celebrating the scholarly and creative achievements of the faculty and staff at Eastern Kentucky University.